Halitosis, Series 8. What is halitosis? Well, halitosis is a general term used to describe bad breath that's emitted from the mouth. Bad breath is a common problem, which often comes from a bacterial imbalance on the back of the tongue, and it's caused by waste products of a variety of bacteria in the mouth. About 90% of halitosis originates in the mouth. Most adults suffer from bad breath occasionally. Many of us have what we call jungle mouth in the morning, or morning breath, that can be cleared up by cleaning our mouth and having something to eat. And there's about 25% of the population that may suffer from bad breath on a regular period. They have chronic bad breath. So bad breath smell. What does it smell like? Well, as I said, there's a bacterial imbalance on the back of the tongue. The bacteria metabolize and they produce waste products, and these are called volatile sulfur compounds. And most persons produce this odor at one time or another. And some of the smells are, one, hydrogen sulfide, which smells like rotten eggs, methyl mercaptan, which is the smell of periodontal disease or jawbone disease in the mouth, and that smells like rotten cabbage. So these are pretty potent odors. Smells from the mouth, oral smells, can come from other sources such as onions, garlic, tobacco, or alcohol. But these are choices that we make, and so we're conscious of the fact that they may have an odor after we have used them. So one thing that people ask is, how do you know if you've got bad breath? Well, we can't smell ourselves very reliably. The nose has been designed in such a way that our smelling is there to protect us so that we can smell things in the atmosphere or foods that are going to be harmful to us if we consume them or in that area. So smelling ourselves is the least reliable. What we can do is take what we call the wrist lick test, and you take your tongue, right from the back of your tongue, lick your wrist, and dry it and take a smell. It's sort of like we use for testing perfumes. Bad breath affects others. Bad breath is in your face when you interact with the residents in long-term care, also at work with your workmates, or in your personal life with your partner. So your bad breath can very much affect social interaction if it's a chronic situation. And then it goes on to affect our self-confidence, our body image, and our self-image. People will often judge other people by their breath odor, and they will stay away. And this will then increase a person's lack of self-confidence. A bacterial imbalance causes chronic halitosis. About 600 bacteria are found to be in the mouth, and it is bacteria, or the waste products of bacteria, that is the most common cause of bad breath. For the most part, the bacteria work in harmoniously and carry out their jobs that they're supposed to do. But for whatever reason, there may be a bacterial imbalance, and certain bacteria will break down proteins to produce these smelly gases, the volatile sulfur compounds. And this bad breath can often be very persistent and very chronic, and a major problem for a number of people. Other causes of bad breath. There are many other factors or causes of bad breath that manifest in the mouth. Poor oral hygiene and lack of oral self-care is a major factor. It's important to reduce the overload of bacteria to make sure that the bacteria is cleaned away from the gums, and that these areas are kept clean and the tissue not inflamed. So oral self-care is really very important. Oral diseases can cause bad breath. Infected, decayed teeth, jawbone disease, also known as periodontal disease, these will cause bad breath as well. Stress can also affect the breath odor. The immunoglobulin A in the saliva, when we're stressed, this changes, and so can contribute to some bad breath. Medications and dry mouth, these two tie together. A number of medications that people take contribute to dry mouth. And once the saliva is reduced in the mouth, then there's less saliva to wash these bacteria away. And so sometimes saliva substitutes can be used to help moisten the mouth. Very important is the frequency and the quality of food and fluid that we intake. It's important to eat fibrous foods and follow the Canada food guides and make sure that we're not eating too many fatty foods, because this can contribute to an imbalance of the bacteria. And it's important to eat on a regular basis, maybe small amounts every 3 to 4 hours, because if we go for long periods of time, we then go into a fasting breath, and then this gives off a very bad odor from the body. Chronic diseases, systemic diseases, such as diabetes, can also give off an odor. So if you know somebody who has got a chronic bad breath problem, it's important that they seek treatment so that, for one thing, it can rule out any systemic diseases. What to do for bad breath? Well, for two things. One, make sure your mouth's clean, and two, if it persists, then get treatment. Bad breath is really a big market, and there are many products out there for temporary relief, and these will last for a short period of time. But with a person for a chronic breath odor problem, it is important to get a professional referral and be treated for the problem. It's a complex issue. It's not a quick fix, and it involves a number of matters, whether it's psychosocial matters, food and fluid intake, all sorts of things. But it shouldn't be ignored. Bad breath is in your face, as I've said before, and should be a signal that there's a problem. So if you've got a breath odor problem, do make sure that you have that checked out. Good basic care is important for reducing halitosis. The SHRTN has produced a number of webinars, and Series 4 is Basic Oral Care, which provides a thorough review on how to look after a resident's mouth. And monitoring or providing good basic oral care is really the best intervention for preventing bad breath for our residents in long-term care. So that can be reviewed, and you'll notice that in the basic oral care, that's important when we're providing care for another person, that we use a longer-handled brush and a very small, soft head so that we can get to the back of somebody's mouth and around the gums better. Just review that. I think you'll find that helpful. Good basic oral care. I can't say this too often. Just clean your mouth properly, and if you're looking after residents, make sure that you keep their mouth clean, and make sure that the brush is used and adapted properly. And think of it as you're adapting the brush. You'll notice how the bristles are right along the gum line, and we're really using the side of the brush rather than the ends of the bristles. Think of adapting how we adapt a soft cloth to wipe off a counter to make sure that it's clean. And it's very important that we adapt the brush the same way around the gum line to keep those areas clean and to get rid of those harmful bacteria. So always start at the gingival margin. Chlorhexidine, either 0.12% or 2%. There's a variation in of these chlorhexidine products. But it's the gold standard. It adheres to the oral tissues for a long time. It can be prescribed by a medical doctor, a nurse practitioner, a dental hygienist, or a dentist. And quite often what we do is we use a dip and brush technique. So we dip the toothbrush in the chlorhexidine, rinse, and then apply the toothbrush in the mouth. You can also dip floss if you happen to be using it, or an interproximal brush as well, and use that to clean in between the teeth. Good denture care is equally important. The dentures need to be cleaned twice a day. They should be taken out, and not just soaked, but actually scrubbed. And you'll notice that the brushes that are on this illustration here, they have a pointed section on them, and that pointed piece goes into the palate of the inside part of the denture, and so you can scrub in there, because the straight part, that longer part, doesn't always fit on the inside part of the denture, and that's the part that touches the mouth, the tissue, and that's very important that that be kept clean. Again, there is a webinar series number 1 is on denture care. It provides a thorough review, and you want some more information, that would be good to look back at that. Keeping the mouth clean is critical to reducing halitosis for residents in long-term care. So it's important that the resident's mouth is kept clean. Ideally, the mouth is properly cleaned twice daily. If the resident is capable of doing their own mouth cleaning, then it's still important to monitor them because, as we know, residents' ability, either physically or cognitively, may deteriorate over time. So it's important to monitor them to see that they are actually doing it and doing it correctly. And again, I reiterate, clean all the mouth surfaces, the teeth, between the teeth, the palate, the tongue, the gums, and the dentures. And I mentioned before that the residents with dentures, they also need their dentures cleaned twice a day as well as their mouths. If these things are put in place and the mouth is kept clean, you'll see at least an 80% improvement in the smell, the breath odor of these residents. And so it means an improved quality of life for you as the people that are providing care to the residents, and also for the residents themselves. That is the content of this presentation on halitosis. I thank you for your attention. There's a number of slides that follow. They give some product information, and they provide other online resources.